Hey everyone, welcome back to PLAB Talks. You're listening to our headache series, where we break down high-yield clinical scenarios for PLAB 2.
And today, we're diving into a big one. It's a case that really tests your structure, speed, and communication.
Yeah, this one, a 21-year-old man, comes in with a headache, fever, photophobia, and has recently returned from Kenya.
That travel history is already setting off alarm bells. So, as the FY2 in clinic, you'd start by introducing yourself, confirming identity, and then gently exploring why the patient has come in. If he's wearing sunglasses indoors, you might say, "I notice you're wearing sunglasses. Is the light bothering your eyes?"
Right, that's a nice touch. Empathetic, but also observational. Then comes the Socrates headache history: location, onset, description, radiation.
And associated symptoms. That's the big one. So you're actively screening for things like fever, vomiting, neck stiffness, drowsiness, visual changes, and, of course, any rash.
Especially that non-blanching purpuric rash, classic meningococcal sign.
Exactly. And you want to dig into timing, what makes it worse, like light or movement, and whether anything helped, like paracetamol. Plus, always ask how bad the pain is on a 0 to 10 scale.
Then it's time for your differentials. Rule out things like migraine, sinusitis, SAH, tension headache, even temporal arteritis, if the age fits.
And because of the travel, you must ask about vaccines, when they got back, and how others who traveled with them are doing.
Systemic symptoms too: fever pattern, night sweats, any cough, GI symptoms, dizziness.
Right. Then past medical history, meds, allergies, family history, travel, occupation, social history, alcohol or drug use, and of course, if anyone else has been unwell.
Then comes ICE, their ideas, concerns, and expectations. Really helps you gauge how worried they are and what they're hoping you'll do.
Yeah. After that, you summarize and ask to examine. You check vitals, look at the eyes and neck, assess cranial nerves, and inspect the skin carefully, especially for that non-blanching purpuric rash.
And in this case, let's say you find fever, neck stiffness, photophobia, and the rash. That's a strong clinical picture.
Definitely. So now let's talk about management, because this is where it gets urgent.
All right, so let's zoom in on what happens once you suspect meningitis. This is where timing and clarity are everything.
Yeah, first and foremost, you act immediately. This is a medical emergency. You give an IM injection of benzylpenicillin right there in the clinic before any hospital transfer.
And you have to communicate that clearly. What would you say to the patient?
Something like, based on everything we've talked about and what I found on examination, I'm really concerned you may have meningitis. It's serious, but we've caught it early. Then say, I'm going to give you an antibiotic injection right now to start treatment straight away, even before you reach hospital. This helps control the infection early, which is vital.
So it's about being direct but calm, helping them feel safe while being honest.
Exactly. Then arrange urgent hospital admission and explain. At hospital, they'll continue IV antibiotics, give you stronger pain relief, maybe steroids to reduce inflammation, and they'll do tests, bloods, a brain scan, and possibly a lumbar puncture to confirm the diagnosis.
And we can't forget, this is a notifiable disease, so we contact the local health protection team.
Yep. And ask about close contacts. In this case, the girlfriend who traveled with him. If she's fine, still say, even though she feels okay, we'll arrange preventative antibiotics today, just to make sure she's protected too.
Mhm. And then you check understanding. Does all of that make sense? Is there anything I can go over again for you?
Exactly. The goal is quick action and clear communication. Both save lives.
That's really well put. And after hospital care, there will be follow-up, hearing checks, neurology or ID reviews, and contact tracing by the public health team.
Yeah, and it's a good time to hand them leaflets, one on meningitis and one on travel health. Also, encourage pre-travel consultations in the future. Vaccinations matter.
Absolutely. Such a high stakes case, but with the right structure and communication, you can genuinely make a difference.
That's it. Quick thinking, clear words, calm presence. It goes a long way.
All right, that wraps up today's PLAB Talks episode. Thanks for joining us, and be sure to catch the next part in our headache series.
Take care and keep revising smart.